It blows me away. It's just the caring, honest to God caring, that everybody, not just the nurses, not just the doctors, my office staff, everybody here, everybody honestly cares about these people. So that's probably why I was a patient here. That's probably why I'm glad to be working here. There was fear in the community, desperation as to what was going on, what was going to happen. And the doctors were, that's what's amazing, the doctors were more concerned about their patients than anything else. Not so much about where their next job, where they may go. They were honestly, actually concerned about these patients, their well-being and their care.
I think Hopeland is a special place because they help people when they need to be helped. When I didn't have insurance, they helped me before I got my job and got my insurance. And they took me when nobody else would take me without insurance.
We here at Hopeland see any range of patients. We have a patient that's close to 100 years old and 1 day old.
Because this is a place that helps you, especially with the single mothers with little babies. They tell them if they need help with them, they come here and they help them. Then they have the social worker that helps them through any problems that they have.
With the elderly, those patients are our specials. Most of those patients have worked very, very hard all their lives at one thing or another, no matter what they did to make a living, and now they're at the age to retire, and retirement is not that great financially. Medicare itself does not supply any kind of prescription coverage, any kind of mental health issues they may have, any issues, how to deal with family, somebody to talk to. We have a representative from the job center that's here that will help them.
If it wasn't for Hopeland Center, I don't know what I would do. They have been very helpful to me. They signed me up for the HCAP insurance, which will help me out as long as it will continue. I do have high blood pressure. It runs in my family. And as long as I've been coming here, I've found out that the doctors are very wonderful.
We've had a particular child. The mother was young and didn't quite understand all that it takes, I would say, in raising a child, an infant. He was underweight, and we needed something done right away. The mother had been counseled several times. The child was referred to Children's Medical Center to get started on a program right away so that he would get his weight, so they could eat, so he can get the proper nutrition. Unfortunately, the mom is no longer in his life, but the child is healthy, he's doing well, and it's wonderful to see that. In my opinion, we're always constantly stepping in, intervene, always trying to educate our patients, our clientele, constantly.
Questions are asked. Sometimes they think we're probing, but we let them know it's just so that we can get them the education they need to survive. This day and time, it's very important for us to get them very, very young, keep them in the system, and keep them going.
It was really hard to take when I found out I was a diabetic. It really was. I didn't take it well, but now I'm trying to take it. And it's a nurse here, one of her kids have the same thing, so when she talked to me about it, it made me feel more comfortable. because I felt that, well, here it is, her child is 9 or 10 years old, and if she can handle it, I should be able to handle it.
When I was very, very young, I went to visit my homeland on the Cherokee Reservation. There is no medical there. None. Well, at that time there wasn't. My dream was to come up with a clinic for that reservation where those people could be treated, get what they needed medically, be educated, know what everybody else in the world knows. Because of its location and my family life, I was not able to move back to the reservation. Not being in that location, donations is all I can do. But I found Hopeland. Hopeland is the same thing. It is that type of clinic. These are people, and I hate to say this, but they've been forgotten. They fall through the cracks. Our goal here, when a patient walks in the front door, is to imagine that your mother or father standing on the other side of that counter from you. How would you want them treated? And I can honestly say my employees do see one of their relatives standing on the other side of that counter, and that's the way the patient is treated. Hopeland was here before Grandview took it over, and a lot of the employees had a chance of transferring and moving on to what others considered bigger and better things. There is nothing bigger and better than Hopeland. The feeling you have when you walk out of here at night, even if there's just that one patient that you touched, makes it worth it.